Have you wanted the simplest way to understand what bipolar disorder is? If you are seeking simplicity in that, then this video is for you. Today we will be learning about bipolar disorder through a story. Meet Daniel. Daniel was the life of the party. Everywhere he went, people noticed him. His energy was contagious, and his excitement for life could brighten anyone's day. He was always full of ideas, big, bold plans that made people believe anything was possible. One week, Daniel decided he was going to start a business that would change the world. He spent days and nights working non-stop, hardly sleeping or eating. He talked so fast that it was hard to keep up, but his passion was undeniable. He believed in his vision so much that he even emptied his savings to make it happen. But then, just as quickly as the excitement came, it was gone. Daniel would suddenly pull away from everyone. He would stay in bed for days, feeling like a failure. Even simple things like eating or answering a text felt impossible. His vibrant energy turned into silence. His friends didn't know what to make of it. They thought maybe he was just moody or overreacting. Some even joked about how unpredictable he could be. But what they didn't know was that Daniel was living with bipolar disorder, a condition that caused his moods to swing between intense highs, called mania, and deep lows, called depression. For Daniel, life felt like being on a roller coaster he couldn't control. Some days he felt like a superhero. Other days he felt invisible. He often wondered if anyone truly understood what he was going through. Daniel felt stuck, trapped in a cycle he couldn't control. But he also felt alone because no one around him seemed to understand what he was going through. Little did he know his journey toward understanding and managing bipolar disorder was about to begin. Bipolar disorder is a mental health condition that causes extreme mood swings. These mood swings include manic episodes, periods of high energy, racing thoughts, impulsive decisions, and little need for sleep. For Daniel, this was when he felt unstoppable and took big risks, like quitting his job to pursue unrealistic goals. Depressive episodes, periods of deep sadness, fatigue, and hopelessness. Daniel's depression left him feeling like he couldn't get out of bed or find joy in anything. Some people also experience mixed episodes, where symptoms of mania and depression happen at the same time, making it even more confusing and distressing. Bipolar disorder isn't just having mood swings. These episodes are intense and can last for days, weeks, or even months, severely affecting a person's life. Daniel's doctor explained that bipolar disorder doesn't have one single cause. Instead, it's usually the result of a combination of factors. Genetics. If someone in your family has bipolar disorder, you're more likely to develop it too, though it's not guaranteed. Brain structure and chemistry. Changes in brain function and imbalances in chemicals like serotonin and dopamine can play a role. Stressful events, traumatic experiences, or major life changes, like losing a loved one or a job, can sometimes trigger bipolar symptoms. For Daniel, there was a family history of mental health conditions, and his episodes often started after periods of high stress at work. When Daniel was diagnosed, he learned that bipolar disorder is a lifelong condition, but it can be managed with the right treatment. First, there's medication. Mood stabilizers help keep the highs and lows in check. Antidepressants are used cautiously during depressive episodes to avoid triggering mania. And sometimes antipsychotics are prescribed if symptoms of mania are severe. Then there's therapy. Cognitive behavioral therapy, or CBT, helps Daniel recognize and manage his triggers and unhealthy thought patterns. Psychoeducation is also important. Learning about the disorder helps Daniel understand what's happening and how to manage it. Finally, lifestyle changes play a crucial role. Maintaining a regular sleep schedule, avoiding drugs and alcohol, which can worsen mood swings, and practicing mindfulness and relaxation techniques are all essential steps. Supporting someone with bipolar disorder requires understanding, patience, and actionable steps. Here's how you can help. First, educate yourself. Learn the basics about bipolar disorder so you can better understand what your loved one is experiencing. Understand the difference between mania and depression. Know that they can't just snap out of it. Their brain chemistry makes it difficult to control their moods without treatment. Be patient. Recovery takes time. Bipolar disorder often involves ups and downs, and it's normal for setbacks to happen. Avoid saying things like, "You were fine yesterday. Why can't you just be happy?" Instead, try, "I know this is tough, but I'm here for you no matter what." Watch for warning signs. You can help by recognizing when they might be heading into a manic or depressive episode. Signs of mania include excessive energy, talking quickly, risky behavior, or little need for sleep. Signs of depression include withdrawal, sadness, fatigue, or trouble concentrating. When you notice these signs, gently encourage them to talk to their doctor or therapist. Encourage treatment. Medication and therapy are crucial for managing bipolar disorder. You can help by offering to go with them to appointments if they're comfortable, helping them remember to take their medication, like setting reminders or using a pill organizer, and normalizing their treatment. Therapy is a great tool to help you feel more in control. Be a listening ear. Sometimes just being there to listen without judgment is the best support you can give. Avoid giving unsolicited advice like, "You should just focus on the positives." Instead, say, "I'm here to listen if you want to talk about how you're feeling." Offer practical help. During depressive episodes, even basic tasks can feel overwhelming. You can offer practical help like bringing over a meal or helping with grocery shopping, assisting with cleaning or organizing their space, and checking in regularly with simple messages like, "Thinking of you. Let me know if you need anything." Create a stable environment. People with bipolar disorder often benefit from consistency and routine. Help them maintain regular sleep and meal schedules. Encourage stress management activities like yoga, meditation, or hobbies they enjoy. Be mindful of your tone and energy, especially during their manic or depressive episodes, to create a calm atmosphere. Respect their autonomy. While you want to help, remember that they are capable of making decisions about their life. Avoid being overprotective or controlling. Instead of saying, "You can't handle this," try, "How can I support you in this situation?" Know when to get help. If your loved one is in danger, such as showing signs of suicidal thoughts or extreme manic behavior, seek professional help immediately. Contact a crisis hotline or emergency services. Let the professionals know about their bipolar diagnosis to ensure they receive appropriate care. Take care of yourself too. Supporting someone with bipolar disorder can be emotionally taxing. Make sure to set boundaries so you don't become overwhelmed. Talk to a therapist or join a support group for caregivers. Practice self-care by doing activities that relax and recharge you. With the right treatment and support, Daniel has learned to manage his bipolar disorder. He still has ups and downs, but he's found stability through therapy, medication, and the unwavering support of his friends and family. He's even started writing a blog to share his journey and inspire others. Bipolar disorder is a challenging condition, but it's manageable with the right support and treatment. If someone you love is living with bipolar disorder, remember, patience, understanding, and small acts of kindness can make all the difference. If you found this video helpful, don't forget to like, share, and subscribe for more mental health stories and tips.